Today, you will experience the life simulation of an ancient imperial court physician. If you cure them, it is expected. If you fail, it is a death sentence. In ancient China, being the emperor's doctor was one of the most dangerous jobs in the world. You were born during the Jiajing reign of the Ming Dynasty, into a family of physicians in the Jiangnan region. Your grandfather is the most renowned doctor in the area, with patients traveling from 100 miles away. From the age of 5, your grandfather makes you memorize the ode to medicinal properties and the song of herbal formulas. Every day before dawn, you are woken to learn the names of herbs lining the walls. By 8, you can identify over 100 herbs by smell alone with your eyes closed. Your grandfather says you are a prodigy, the finest talent the family has seen in a century. At 12, your grandfather begins teaching you pulse diagnosis. He explains there are 28 types of pulse, each corresponding to different conditions. It takes you 3 full years just to learn to distinguish them all. At 15, you treat a patient on your own for the first time. A peasant woman suffers from persistent abdominal pain. You diagnose cold stagnation and prescribe a modified Lizhong decoction. 3 days later, she recovers, and you are too excited to sleep that night. At 18, your grandfather passes away. On his deathbed, he holds your hand and says your family has practiced medicine for 3 generations. But if you ever get the chance, you should try for the Imperial Medical Academy. There you can save more lives and bring honor to the family. The Imperial Medical Academy of the Ming Dynasty is the nation's highest medical institution. To enter, you must pass multiple rounds of examinations covering classical medical texts, herbal formulations, clinical diagnosis, and even your calligraphy and appearance. At 20, you travel 1,000 miles to the capital to take the Imperial Medical Academy's entrance examination. Over 300 candidates apply, and only 12 are accepted. You rank 3rd and officially become a medical officer of the academy. Once inside the academy, you realize how strict the rules are. The academy is divided into 13 departments, and you are assigned to internal medicine. Your daily tasks include copying prescriptions, treating lower-ranking officials, and studying case records from senior physicians. The academy has an ironclad rule. Treating the imperial family requires at least 2 physicians present. Every ingredient must be documented, and all prescriptions must bear the doctor's signatures and seals. If anything goes wrong, everyone who signed is held accountable. A senior colleague tells you something you will remember for the rest of your life. In the academy, medical skill is secondary. What matters most is not making mistakes. It is better to prescribe mild and slow remedies than to use aggressive treatments. No one remembers you for curing someone, but if something goes wrong, your entire family pays the price. At 23, you are summoned to the palace for the first time. A consort has suffered from migraines for days, and the academy sends you alongside a senior physician. After your diagnosis, you recommend Chuanxiong tea powder, but the old doctor firmly disagrees and insists on a mild tonic prescription. You do not understand why the right medicine is not being used. The old doctor tells you privately that this consort has recently fallen out of favor. If she has any adverse reaction to your prescription, those eager to please the emperor will accuse you of harming her. Only then do you realize that treating patients in the palace means reading not just their illness, but the politics around them. At 25, your caution and solid skills earn you a promotion to clerk physician. That same year, the Jiajing emperor becomes obsessed with Taoist alchemy and immortality, ordering the academy to assist alchemists in refining elixirs. You know those elixirs contain cinnabar, mercury, and lead, and prolonged use will certainly cause poisoning. But you dare not speak up. The last physician who advised the emperor against taking elixirs was beaten with 80 strokes and exiled to the frontier. All you can do is secretly reduce the dosage of toxic ingredients during preparation and add extra licorice root and mung beans to counteract the poison. You walk this tightrope for years. In the winter of your 29th year, the emperor suddenly develops a high fever that will not break, going 3 days without food or water. The entire academy panics. The director brings 6 physicians to take turns examining him, but no one dares write a prescription, Because everyone knows that if the emperor dies after taking your medicine, it means the annihilation of your entire clan. In the end, the director calls your name. You know full well you are being pushed forward as a scapegoat. But after carefully reading his pulse, you determine it is a high fever caused by wind-cold invasion that requires a strong dose of Ma Huang decoction to induce sweating, or the pathogenic heat will penetrate deeper with dire consequences. You write the prescription, personally brew the medicine, and feed it to the emperor with your own hands. That night you kneel by the dragon bed, not daring to close your eyes for a single moment. Past midnight, the emperor finally begins to sweat, and by dawn, the fever breaks. When the emperor wakes, he is overjoyed, rewarding you with 1,000 taels of silver and promoting you to imperial physician. Overnight, you go from a minor clerk to a doctor who treats the emperor himself. But you know in your heart that had the outcome been different, today's reward would have been today's death sentence. At 32, you are one of the most senior imperial physicians in the academy. But the real test is just beginning. The queen's personal eunuch approaches you, hinting that you should prescribe a pregnancy-stabilizing formula for a pregnant consort, but with a blood-activating herb added. You immediately understand. They want you to cause a miscarriage through medicine. You refuse, but they threaten you, saying your position in the academy is only secure because of the queen's protection. Cross her, and you will not only lose your title, but your entire family will have old debts dug up against them. You think all night. The next day, you volunteer to examine the consort, and in front of everyone, you diagnose her as physically weak and in need of rest, recommending a change in her dietary regimen. You use the safest possible approach to protect the consort while avoiding a direct confrontation with the queen. But the incident leaves consequences. 3 months later, the consort has a difficult delivery. The mother survives, but the child does not. The queen seizes the opportunity to tell the emperor that your medicine was at fault, and the emperor orders you thrown into the imperial prison. In prison, you endure the darkest 3 months of your life. Every day, interrogators come to pressure you into confessing that you deliberately killed the prince. You refuse to break, insisting your diagnosis was correct. In the end, it is the consort herself who saves you. She sends a handwritten letter to the emperor, explaining that her own weak constitution caused the difficult birth, and that your prescription was entirely proper. Only after reading her letter does the emperor order your release. After your release, you are demoted back to a common medical officer at the academy. Falling from imperial physician back to where you started, many colleagues mock you behind your back. But you actually feel relieved. At least you no longer have to be dragged into those deadly palace intrigues. From 35 to 40, you settle into teaching students and organizing case records at the academy. You compile your years of palace medical experience into a book of case studies, documenting both treatments for difficult conditions and, between the lines, the art of surviving as a court physician. At 45, the Jiajing emperor dies. The cause, just as you had long suspected, is chronic poisoning from years of consuming alchemical elixirs. After the new emperor ascends the throne and reforms the academy, you are reinstated as an imperial physician for your experience and skill. But this time, you have learned your lesson. You proactively submit a memorial to the new emperor, recommending the abolition of alchemical elixir practices and a return to orthodox medicine for the imperial family's health. The new emperor accepts your proposal, and the academy is never again forced to assist with those deadly elixirs. After 50, you gradually hand your work over to the younger generation. Your greatest wish is to retire and return to your hometown in Jiangnan, to open a small medicine shop and treat ordinary people, just as your grandfather once did. At 53, you are finally granted permission to retire. On the day you leave the capital, your students see you off again and again. You look back one last time at the red walls and golden roofs of the Forbidden City, your heart filled with 1,000 conflicting emotions. Back in Jiangnan, you truly open a small medicine shop, naming it the Hall of Universal Relief. You no longer worry that a wrong prescription could cost you your head, no longer have to choose sides between the queen and her rivals. Every day is simply treating common colds and headaches. Life is plain, but peaceful. In your lifetime, you walked from a small village clinic into the Forbidden City, and from the Forbidden City back to a small village clinic. You saved the Emperor's life, and you nearly lost your own to palace intrigue. The world envies the glory and wealth of an imperial physician, but only you know that beneath that official's cap hides a blade that could fall at any moment. This was the life of an ancient imperial court physician.